Today we are going to start the basics of an autocoils. Okay, so let's start the autocoils chapter. So what basically the autocoils means? Autocoils is made up of two words, that is autos and coils. Okay, so autos is means self and coils mean healing. So so whenever our body undergoes severe damage or any physiological agitation or anything, there are several substances in our body which are self-repellable substances. They are called autocoils. And the another name of autocoils, that is synonym of autocoil, is called local hormones. But remember one thing, that is autocoils is called local hormones, but and also called as local hormone, but not as hormone and not an enzyme, because enzyme act as a specific site and release from endocrine gland, and here autocoils does not release from endocrine gland. Okay, and also you have to add one point, that is it has a very low half-life. Okay, this half-life, so its mechanism of action is too short compared to the enzymes. The autocoils involves in many physiological plus pathological events. In physiological, it involves in many physiological pathological process and event. In physiological process, it maintains the normal set point of a body, that is a normal temperature, normal body regulation, normal homeostasis, normal set point of atmost everything. And pathological process is leads to the characterized or phenotype of an illness. Now we come on a classification of autocoils. On the what basis autocoils are classified? On the basis of constituents. That is one is an amine constituent, one is a lipid derivative, one is a peptide autocoils, and certain others there are many. So today we see about the histamine. Focus on histamine today. Today we focus on histamine. Okay, so the amine autocoils. The example of amine autocoils includes the histamine and serotonin. That is 5-hydroxytryptamine, and lipid derivative includes prostaglandins, leukotrienes, platelet activating factors, etc. And on peptide autocoils includes plasma kinins, bradykinins, kaolin, angiotensin, and certain others. There are autocoils which I have mentioned here is the interleukin, tumor necrosis factor alpha, peptides like the gastrin, somatomedin, vascular peptide, etc. All these are called autocoils. So today we must focus on the histamine. Okay, histamine. So what does it mean? Histamine means tissue amine. Histamine tissue, and amine means amine, you guys know it is a functional group NH2. Histamine tissue. So histamine produced by the many sources like animals and plant, also by stinging needle plant, by fish, by any insect bite, and much more things. It is a mediator of hypersensitivity phenomena. You know what is a hypersensitivity phenomena? Here I am drawing a diagram. So the granules of mast cell present as granules. These all are granules of histamine, and these are the antibody IgE. So on the exposure of first antigen, there is no such hypersensitivity seen, because the IgE can bind to these cells. On considering second exposure, suppose this second exposure antigen can bind to the antibody and agitate the mast cell and produce the exocytosis of this granule into blood circulation. This is blood circulation, and produce local atopy or anaphylaxis. The histamine are present in our body are two types. There is a mast cell secreted and non-mast cell mediated. Mast cell secreted are lungs, liver, placenta, intestinal mucosa. Non-mast cell includes brain, epidermis, gastric mucosa, and growing regions. Also present in blood, venom, and pathological fluids. Now we see the synthesis, storage, and degradation. Synthesis from amino acid, that is histidine, degraded rapidly by the oxidation. The histidine is degraded rapidly by oxidation and methylation. So histamine is degraded by methylation. So in toxicity of histamine, that is a toxicity of histamine, we would like to degrade histamine by giving adrenaline, because adrenaline contains the functional group methyl. So methylation takes place and inactivation of histamine takes place. So there is a symptomatic relief of an anaphylaxis. Here you can see the figure. That is this whole square indicates the mast cell. This positive cell indicates the histamine positive, protein is negative, and heparin also negative. This positive negative reaction takes place and binding of this protein heparin to the histamine takes place. Mast cell contains positively charged histamine, so it has attraction with negative charge protein by heparin, as earlier mentioned in figure. Release of histamine from the mast cell. These all whole are mast cell, and this all vesicle of histamine granules. Okay, so this outside in this is intracellular fluid, extracellular fluid. So histamine, as I had told earlier, there is a positive charge. So histamine, whenever there is a release of histamine, so there is a decrease of positive charge inside intercellular fluid. So from the extracellular fluid, sodium moves inside. This movement of the sodium inside takes place to maintain the balance of positive ions in cell. You know what? The orally histamine is not effective very much because it is degraded into the liver. Liver degradation takes place. Now we come on histamine receptors. There are basically the 4 histamine receptors theoretically, but one extra receptor, that is a 5, is added on the congenital electrochromography or some other immunosectioning. But for now understanding, we would consider only the main 3 receptors, and these two are for the research purposes. Now we would like to see the actions of individual receptors. H1 receptor, H2 and H3 receptors. The most important are the H1 and H2 receptors. H3 are not much important as like H1 and H2 receptors. So what are the actions mediated by the H1 receptors? First of all, H1 receptors are located at smooth muscle, airways, intestine, blood vessel. Now we see the actions. Smooth muscle contraction, bronchoconstriction, intestinal constriction, uterus, blood vessel. So bronchoconstriction leads to an respiratory problem, and if person have anaphylaxis or asthma, can be severe by this test. So it is dangerous to perform. Intestinal colic, and it also causes an abdominal cramp. And it is whenever there is histamine extra H1 receptors, there is a dilatation of small blood vessels and constriction of large blood vessels. The dilatation takes place by the endogenous derived growth factor, release factor, that is a nitric oxide mediated. It is also called an indirect release. Efferent nerve stimulation leads to the pain pathway stimulation, and you feel the constant itching sensation. Adrenal medulla, whenever the histamine acting adrenal medulla, there is a release of catecholamines and adrenaline, so there is a boost up of heart functionings. Okay, and blood pressure also increase. In brain, stimulation of postsynaptic impulse. Now we come on H2 receptors. H2 receptors are located on the gastric mucosa. You can see here, this is gastric mucosa. This is in gastric mucosa. Here are the H2 receptors I have labeled. So stimulation of gastric receptors can produce acid secretion. Stimulation of H2 receptors leads to the much of acidity in our stomach, and also there is a pepsin release. It can also present in heart. There is a positive chronotropy, and ventricle is a positive inotropic effect. Now let's come on H3 receptors. Receptor inhibit the histamine release, so it is also called an autoreceptors. It will produce sleep because there is an decrease the release of the histamine from the brain, lungs, spleen and skin, gastric gland, decrease secretion. Okay. You can once again you can see this figure. This is a mast cell. Okay. This is a histamine granules. This is sodium comes from exterior to interior. Whenever there is a release of histamine takes place into exterior cellular fluid, the sodium ions sense it and to balance it, the sodium moves in. So there is a maintenance of the positive ion stability in this. Okay, you can see this figure again. Gastric mucosa has H2 receptors. When the stimulation of H2 receptor takes place, histamine is released and person feels gastroesophageal reflux or a hyperacidity or a stomach ache. Now we look on pharmacological actions of histamine on the several body parts. That is, first we will see on the blood vessels. Okay, so blood vessel. Small blood vessel leads to dilatation. Small blood vessel include capillary, venous arterioles. Dilatation of small blood vessel takes place. So there is a decrease in the blood pressure or hypotension. There is a postural hypertension also noted. And large blood vessel, there is a aortic blood vessel and many brachiocephalic vessels leads to constriction. On rapid intravenous injection, it causes a decreased blood pressure, short lasting by H1 receptors and act on H2 receptors. Remember, the H1 receptor has a more affinity of histamine than H2 receptors and has long lasting effects. Here you can see the figure. This is a H1 receptor mediated dilation. First of all, this H1 receptor is present here. These are the histamine granules come here and produce nitric oxide, EDRF, endothelin releasing growth releasing factor. This leads to vasodilation. So there is involvement of NO. This is called indirect vasodilatation. And vasodilatation mediated by H2 receptors. There is no mediator direct. You can see here is H2 receptor. H2 receptor, when is a coming of granules and H2 receptor contact, there is a direct vasodilatation. No production of NO. So it is called direct. And this is called an indirect. Whenever there is a rapid intradermal injection of histamine, there is a response, a triple response in. First, there is a red spot, wheal and flare reaction. Red spot reaction. Okay, so first step, intense capillary dilatation leads to red spot. You can see there is a normal capillary size and dilated, so the red color appears. Wheal. What is meant by wheal? Due to removal of fluid from the capillaries, there is an here you can see that this is capillary, this is removal of fluid and exudation. This is exudation. This leads to wheal response. And flare, redness in the surrounding area due to the arterial dilatation mediated by axon reflex. This is an blood vessel and you can see the flare reaction due to axon. This is nerve dependent reaction. Now on heart. In heart it has a positive actions. There is a heart rate is increase, cardiac output rate increase, and force of contraction of ventricles especially is increased by H2 mediated. So H1 mediated, this is all cardiac output increase by H2 mediated. When there is an H1 mediated, there is a negative effects, mainly seen on AV conduction and produce arrhythmias, slowing of AV conduction. So this drug is not in combination with an heart prolonging effects. It prolong the QT interval. Once again, H2 dependent histamine can produce positive effect in heart. H1 effects of histamine in heart produce negative effect, especially AV conduction. Now visceral smooth muscles. Bronchoconstriction takes place by H1 mediated histamine receptor. Abdominal cramps occurs due to the constriction of the intestine, and also the production of colic is seen. Now fourth number, glands. You can see here is the H2 receptors. Histamine came into contact with here and increased glandular secretion. Histamine causes increased acid production plus pepsin release by increasing CAMP, that is a cyclic AMP, addition monophosphate, stimulate active membrane proton pump. So there is a increased permeability and H plus and potassium pump. So the more and more acid production takes place. In the cases of burns, this is the most important. This is the more important MCQ asked. In burns, histamine releases too much. Histamine also leads to the stimulation of sensory nerve ending and feels you itching and intense of itching and itching and itching. This is also leads to urticaria. Histamine in high concentration also leads to stimulation of pain pathway. Autonomic ganglia and adrenal medulla. Stimulation of these two things can lead to the positive cardiac effects, and blood pressure is definitely will increase due to the positive cardiac effect and release of adrenaline. So BP is also increase. Okay, blood pressure, peripheral registration is increase. On the central nervous system, histamine does not enter into brain. Central nervous system, histamine does not enter into brain because it is impermeable to blood-brain barrier. So only the peripheral action are seen, no central effect are seen. But however, when we inject histamine into the intraventricular injection, it leads to increase in the rise in the BP, blood pressure, cardiac. There is a positive response, increase contraction, increase rate of impulses of AV conduction, behavior arousal. That is, a person is not able to sleep proper, hypothermia, patient feels too much of cold in spite of good environmental condition, vomiting due to gastroesophageal reflex, gastroesophageal reflex, antidiuretic hormone release. This thing is mediated by both receptors, by H1 and H2 receptors mediated. Thank you for watching, everyone. If you want this notes copy, please comment below, so I can send you the notes copy.